my topic is how to improve the clinical diagnosis of migraine. It's not that the clinical diagnosis of migraine is that hard to do. We have a great classification that helps us to make the diagnosis either in clinic and in research settings. So it's not a huge problem to make the diagnosis. However, there are a lot of symptoms. Migraine is a syndrome, and there are a lot of symptoms that may be a part of the clinical manifestations of migraine that help us understand the brain mechanisms behind the migraine syndrome, and that are not present in the clinical criteria. So sometimes they're prone to be confused. Migraine is prone to be confused because of these symptoms with other disorders. Like if you have autonomic symptoms in your attacks, sometimes you're diagnosed as sinus headache because the headaches in the front of the head and your nose might drop a little and your eyes may get a bit watery. Or if you have neck pain in your attacks, sometimes you're diagnosed with cervical problems and not migraine. So this is the view that I will take about less or non-diagnostic symptoms that are a part of the syndrome and help us understand how the migraine process occurs in the brain. I will include some other symptoms like cognitive symptoms. So for instance, that's an area in which I'm interested in research and are very relevant for migraine diagnosis and for migraine impact. So we will cover that also and try to understand how all the symptoms fit together in this complex brain syndrome, and to get the idea that, in fact, migraine is a complex brain disorder that involves all the brain.